Well, joining me today is Dr. Mahlon Kerr, a plastic surgeon from right here in Austin. Thank you so much for being here today.
Thanks for having me.
You said you've seen an increase in these cases recently.
I have, and I think it's a really interesting trend. When I first moved to the Austin area, I might see, one or two a year, but now it seems like we're seeing them really almost every week. And I think that what you see people dealing with a 20-something workplace, which has become very difficult. And I think they realize that this is clearly a social stigma when it comes to finding a professional job.
Yeah.
And so they have to look to surgery to try and make that better.
We see a lot of different cases here, and I know you said this one right here would make it a little bit more complicated because there are, I guess, multiple hoops. Is that?
Absolutely. So
right?
The size of the gauge is important. I would say that the average gauges in the Austin area are usually like maybe 5/8 to an inch. Some of them get quite a bit bigger. Like this girl here has a very large gauge, or this guy down here. Having multiple holes obviously makes it a little bit more challenging. But overall, it's a relatively pain-free operation that's done in the office, just under local like Novocaine, and people do pretty well. I mean, there's not a lot of downtime, and they tend to look pretty good even within a few weeks.
So what exactly does the procedure do? What makes it so difficult?
So what makes it difficult is that as the ear anatomy is changed and it gets really stretched out, our goal is really to reestablish that natural curve and the natural border of the ear, and so you kind of have to work with what's left. And as the ear gets thinner and thinner, it becomes more difficult to have that sort of natural slope in the earlobe. Okay, and so each ear is different, actually, believe it or not, within each person, and so you really have to look at each ear and determine what the approach is going to be. But that said, it really takes less than an hour to do, even both sides, and sutures for 10 days, and don't have to go to sleep for it or anything like that. So it's ideal in that ear is easy to numb. So
what's the biggest one you've seen?
The biggest one I've seen is well over an inch. And that is, I mean, that's an impressive hoop. I would tell people that are interested in having this done, it's ideal if they can leave the gauges out for a month or two. Things will constrict a little bit over time, and somebody who's even got really small gauges, sometimes that can make things tremendously easier.
Interesting. I can see how it would be a popular procedure here in Austin.
Yeah.
Dr. Mahlon Kerr, thank you so much for being here today.
Thank you. Cheers.